Today, we are excited to welcome Domonic Hopson. Domonic is the president and CEO of Neighborhood Family Practice, joining the organization in May of 2022. Before joining NFP, Domonic was Chief Executive Officer of the City of Cincinnati Primary Care and the Assistant Health Commissioner for the City of Cincinnati. He previously held regional and operational management positions within the Department of Veterans Affairs at VA medical centers in Tennessee, Kentucky, and Mississippi. Domonic has made a great impact here in the community since his arrival. He has been recognized by Crain's Cleveland Business Magazine on the 40 Under 40, Notable Leaders in Healthcare, and New Faces and New Places lists, and by Modern Healthcare as a top 25 emerging leader. He serves on a number of boards, including the Collaborative to End Human Trafficking and the Three Arches Foundation, and is a proud graduate of the Leadership Cleveland class of 2024. Please welcome Domonic.
Thanks, Rachel. And I appreciate everyone taking time from their lunch to join in this conversation. I'm excited to share a little bit about the work that we're doing here at Neighborhood Family Practice, but also at a higher level, touch on some of the things that we're seeing across Cleveland. So I will jump in and share some slides here. Okay, so starting off, and I think if you've heard me speak before, or if you hear me today, you're going to hear some passion that comes through about the work that we're doing, but also some of the challenges that our community members are facing. And a lot of that is coming from my personal lived experience. So on the left there is a picture of me and my mom and my brother. And in the background behind us, you can see one of the public housing complexes that we lived in at some point during my upbringing. So when we talk about people navigating poverty and all the system issues that they face, trying to improve their lives, whether it be economically or health-wise, this is something that's personal for me because I have that lived experience, and I want to make sure that we are doing the best we can from a social service perspective, but also just as a community to uplift and provide those opportunities for those who have not had them in the future. And so for us at Neighborhood Family Practice, from a health perspective, we want to be the catalyst for change. We want to make sure that we are pushing the system further, bringing other partners to the table, both our traditional hospital system and healthcare partners, and some of the non-traditional partners like our social service organization or some of our corporate and business community. And we believe that it's going to take all of us to truly move our community forward and address some of our long-standing historical areas where we have fallen short when it comes to outcomes in our community. So when I talk about that, there's a couple of things that I'll touch on. The first one is that we have to acknowledge that we do have world-class healthcare here in Cleveland, and there are people that are traveling from across the country and across the world to receive care here locally in Northeast Ohio, whether that be at Cleveland Clinic, University Hospital, or at Metro Health. But despite that world-class healthcare, we still have poor outcomes. And in many cases, I would even take that a step further and say that we have third world outcomes when you compare some categories. And just highlighting a few of them here, one of them is something that we talk a lot about here in Cleveland, and that we've seen things get worse over the last few years when it comes to infant mortality. And as you can see, when you compare our Black infants to our white infants, it's more than double, almost 3 times when it comes to that mortality rate. And if you look at our life expectancy, and I'll share a slide on that here in a second, and you compare our life expectancy for Black males on the east side of Cleveland, it is comparable to some of the least developed African countries in the world, and we should be ashamed of that. And then lastly, highlighting our prevalence of asthma, diabetes, hypertension, and other chronic conditions in some of our neighborhoods are at rates that are not sustainable. And I think there's a lot of room for us to improve in that area. And as you can see at the bottom of the line there, I think we can do better, but we have to do better. Our community, we owe our community that, and it's going to take all of us to come together to achieve and improve these outcomes. So these are slides and maps that we've all seen before. We know that there is a 23-year difference in life expectancy of people that live less than 2 miles apart. We know that when you look at our maps, when you look at the prevalence of diabetes or people struggling with mental health or physical health, these maps mimic the red line maps that are very familiar to many of us who work in this space. And so the question is, what can we do about that? What is already being done, and then how do we fit into this work? And this is, I would say, a positive. We all know, we talk about social determinants of health, social drivers of health, and that touches on everything from economic stability, food security, education, housing, and a number of other factors. And of course, healthcare is a piece of that. But there is a lot of work going on right now across Northeast Ohio, and that is some work led by our mayor, Mayor Bibb, at the city of Cleveland, our county council executive, and the council members from both of those areas, our philanthropy community, business leaders. A number of people are focusing, trying to close our housing gap, trying to include the quality of the education our kids receive. The food bank and other organizations are trying to address our areas around food security, but also find other creative ways to make sure that people can provide for themselves. And those are all amazing things. But when I think about them, some of them, especially like housing, it's going to take decades, multiple decades likely, to close our housing gap when it comes to affordable and quality housing. So I ask myself and I ask our community, what can we do today? What is the item? What is the action, the step that we can take today to improve the health of our community? And I believe the answer to that is investing heavily in primary and preventative care, especially integrated primary and behavioral health care. And I would say that is one of the things that we do well at Neighborhood Family Practice. We've learned that we are a small piece of our larger healthcare system. And what we found is that we can really focus on that integrated care model, and it results in improved outcomes. So we're asking our partners, those of you on this call and others who are going to listen to this, this is an action step that we can take today. We need to continue doing those other things. We need to continue going upstream from a public health standpoint to focus and address some of those longstanding issues. But there are actions and steps that have an immediate impact. And what I mean by that, if our residents are receiving primary and preventative care and they're being screened for cancer and they have an early diagnosis, then they have a much higher likelihood to be able to access that world-class healthcare that I'm talking about. But if they don't have access to primary and preventative care, by the time they show up to a hospital system, they're not going to be a candidate to receive that world-class care. So our focus here at Neighborhood Family Practice is building a world-class front door to healthcare, which is different, I believe, than what we have right now. So at NFP, we are currently serving over 22,000 patients across 81,000 visits, and primarily on the Cleveland's west side and in Lakewood, Ohio. And our model is an integrated care model where we started with a foundation of primary care and behavioral health. And over the last 40 years, we've grown to add different services that you can see in this wheel here. And we've intentionally created this graphic to wrap it around our patients, because we believe that integrated care model is a way that makes it easy for our patients to access our services and easy to navigate our healthcare system. And we do the same when we are referring our patients to our partners at our hospital systems and other organizations that we partner with. We currently have over 220 team members, and they are all dedicated and committed to improving the health of our patients and making sure that we are impacting our community and our healthcare system in the most impactful way. And the last thing that I will point out is on the outside of this wheel, you see things like financial assistance, transportation, and interpretation. Those are all critical services that are not a direct service line like pharmacy or refugee health or HIV, but they are critical to providing care and receiving those improved outcomes, because so many of our patients are struggling with areas like interpretation. For example, 29% of our patients prefer to receive their care in a language other than English. So we've been very intentional about investing both in a workforce that's bilingual, but also accessing tools that allow us to interpret and provide the highest quality care for our patients. So more about our approach. Over the last 40 years, again, we've been targeted when it comes to identifying where does it make sense for us to provide care, and then choosing what services make the most sense for our patients, understanding that we can't be everything to everybody, and we want to make sure that whatever services that we do provide, we're providing them at the highest level possible. The next step to our approach is providing high value care. So we've invested heavily in identifying and hiring the top talent, but also giving them the tools and the resources available so that they can provide the best care for their patients in an integrated way. And then lastly, a specialized delivery model. We know that every one of our patients may not want to be seen in the office, so we do offer telehealth services. We have a patient advocate model, a population health team that is reaching out and helping to solve barriers for our patients and making sure that we're connecting them to the right resources and bringing those traditional and non-traditional healthcare partners to the table to make sure that we are supporting our community in this work. And the results from that approach are here on this screen. So I think the first graphic I will show is that for a subset of our patients, that we are monitoring the total cost of care for them. Over the last 3 years, the cost of those patients have come in $60 million less than the expected cost that Medicaid was expecting to pay on their behalf, which is a big number and speaks to the impact that we're having both on our patients, but on the larger healthcare system. And what that means is our patients are staying out of the ED. They're not being admitted to the hospital at the same rate, which saves all of us money because it starts to impact the amount that we all pay for our insurance to receive the care that we deserve. To the right there, you see that we've had a 17% increase in our patient volume over the last 6 years. But not only have we seen that increase, we've also saw an improvement in the outcomes for our patients. So if you move down to the bottom, when we look at midwifery and you compare our outcomes for our Black low birth weight in Cleveland is around 17%. For NFP is 7.2%. If you compare our Black preterm births for Cleveland, it's at 16%. And for NFP in our patients, we're at 2.9%. A stark difference between those. And we owe that to our team members, our midwives, and the teams that are supporting them and providing care to our patients. And then if we move over and talk about chronic conditions, which are critical to when we talk about quality of life and life expectancy, you can see that year over year, we're improving when it comes to the number of patients, the percent of patients who have been diagnosed with hypertension, but that have their hypertension controlled. And then for diabetes, it's a reverse measure. So you want to be lower on that one. And you can see that from 22 to 23, the number of our diabetic patients who have poor controlled or uncontrolled diabetes has decreased over time. And we've done it at the same time that we've been able to increase the number of patients that we're served, which is something that is extremely exciting and important to us. And lastly, we're focused right now on how can we expand our reach. We know what we've been able to do over the last 40 years. And our goal is, of course, to bring other people to the table to make sure that we are all accountable for the care and the outcomes of our community. But we're going to do the best we can with the patients that we're serving. So we're excited to share that we do have a new relocated health center that's opening in March of 2025. And we will be relocating our health center that's currently located on West 117th in Lorraine, and it will be moving to West 130th in Lorraine. And one interesting thing, or I wouldn't say interesting, is actually very disappointing. That general neighborhood has had 3 pharmacy closures in the last 2.5 years. So for us to be able to bring a pharmacy back to that neighborhood is something that we're extremely excited about. And it's going to mean a lot to our patients when it comes to controlling those chronic conditions that are so dependent on those prescriptions that they're being prescribed, or the medicines they're being prescribed from their providers. But in addition to the pharmacy, we are going to be able to expand dental at this site. We're expanding the amount of medical and integrated behavioral health that we're providing. And again, it's that integrated approach, that integrated model that we believe has resulted in improved and outcomes that have outpaced our community. There are other plans that we have in place to hopefully partner with other organizations and open new sites across the city of Cleveland. But our focus right now is this new location and making sure that we're successful in that launch in March. And then we'll turn our focus to see where else can we look to support our community and work with our partners to improve the overall health. And the last thing I would say before we open things up to questions. Again, we have to continue to invest in housing. We have to continue to invest in education and economic mobility. But what I am saying is many of those things will take multiple years and decades sometime to improve and move our community forward. We can truly invest today in primary and integrated care, and we'll see outcomes immediately when it comes to screening for chronic conditions, cancer, and then making sure that we're vaccinating our kids and keeping our kids healthy from a well-visit perspective. So thank you all for joining, and I'm looking forward to hearing some of your questions and continuing this conversation.
Dominic, thank you so much. Let's start with diving a little bit into your structure. So NFP is a federally qualified health center. Can you talk a little bit about what that means for your funding, the services you provide, and other FQHCs in town?
Sure. So I think there's total maybe six other total of 6 federally qualified health centers in larger Northeast Ohio. But there's a few things that stand out about us and with our status. One of them is that we do receive federal funding to support our operations. And with that funding, there's an expectation that we are going to open our doors to everyone and not turn anybody away because of their inability to pay. There's also an expectation that we have a nonprofit board that is a majority patients, which is the key thing to make sure that people who are experiencing the care are also making the strategic decisions around what we're doing. And those are two of the key factors. There's other compliance factors and things that we must maintain and monitor. But the key point is that we must be in underserved neighborhoods. We need to provide comprehensive, integrated primary and preventative care. And we have to welcome everybody that comes to see us. And I think all 6 of us are a little unique and different in the sense that we are maybe behavioral health forward, or we're very much primary and integrated behavioral health forward, and we've grown over the years to add some other services that are shown on that wheel there. But those are the foundational pieces that we all have in common. And I would say we all collaborate very well here in Cleveland and trying to make sure that we're all moving ourselves forward to support and fill the safety net that we have here locally.
Has your experience so far been one of if you build it, they will come because the need is so great? Or do you partner with others already in the neighborhood, like schools, to bring patients in?
Yeah, I think you have to partner. The model that you build, that they'll come. I think in some cases that's true, but it really comes down to relationships these days, whether it be schools, faith-based institutions. We've learned a lot. I think we all have during the pandemic. And that was one of those things where we all had vaccines, right? We all had things available and people were not coming, or at least the people who needed those vaccines most. So it's critical for us to be intentional from a community engagement perspective. And we believe that is an area that we have excelled in and truly becoming a fabric of the communities that we serve. And that's something that we'll be looking to replicate as we move into new neighborhoods, right? Because I think our existing footprint, we've been here for 40 years. So that's work that we've been able to build in our reputation. Our brand has been built over 40 years, which is something that'll be new as we look to explore different areas. But we will make sure to intentionally partner with both schools, faith-based, but also existing social service organizations that are in some neighborhoods that people are already depending and relying on for their care and their services.
And as you mentioned expansion, there's curiosity if those plans include expanding to the east side.
There are, our board has improved us to look and explore a site in the central neighborhood in partnership with the Sisters of Charities and the St. Vincent Charity system that closed their hospital a little over a year ago. And so that is a project that we've been working on for over a year now. And we're excited and hopeful that in 2025, we'll be able to bring that new clinic to life. But that is one for sure that we have in place. From moving on from that, we want to make sure that we are slowing down and not overwhelming our system and stretching our resources. And that's where it's so key to have great partners, whether that be the business community, our philanthropy community, or in this case, it is our Sisters of Charity who are supporting us in that move. In many cases, there are not the type of partners out there that make this move possible, especially when you consider our business model in the sense that we're primarily providing care to those that are navigating poverty. whereas 60% or more of our patients are at or below the 200% of the federal poverty level. So there's cases where from an operating margin standpoint, we need to have those key partners to fill that gap. So we're open to exploring further, but right now we want to make sure that we're patient and strategic with those plans to move and expand, understanding that there are already partners in some of these existing neighborhoods, and we want to do that in a collaborative way.
So you have been having kind of an excellent social impact campaign around HIV. Do you find that this is effective in building trust to gain new patients into your HIV clinic? And how about with the HIV testing and prevention services side?
Yes, it has been successful, and we've seen the volume of people being screened for HIV and other infectious diseases increase with those campaigns. And it's one of those things, again, where we're leaning in and being led by our community and listening to the feedback to say, hey, these are the individuals that we haven't historically been able to reach with our campaigns, and we recommend that you all do things differently. And of course, our leadership at NFP, under the leadership of Andrea Lyons, has listened to that feedback and responded to it. And sometimes we feel like we know best, right? We've been doing this for 20 or 30 years. But when we think from that mindset, we missed the mark. And we've been very welcome to the feedback of community members who are having unfortunately a disproportionate impact by some of the things like HIV, and made sure that our campaigns are focused on getting deeper into those communities and letting them know that we've created an environment at NFP that welcomes them in a culture that appreciates the challenges that they're facing.
And you have referenced partnerships and collaborations throughout your discussion. And can you share more about some of those key collaborations? I saw recently an announcement around one with Birthing Beautiful Communities.
Yeah, I would love to talk more about that one in particular. Again, we've seen over the years that having a doula, a woman having a doula, improves outcomes, because there are so many things that our parents and women are navigating as they enter and begin the path of childbirth. So whether that be postpartum or before we're arriving to the hospital, that education, that support is critical. And so for us, when we had an opportunity to either build our own doula department or partner with an organization doing this work, it was a no-brainer for us. And I was lucky to have my Leadership Leading 2024 classmate and Jasmine Long having, willing to answer the phone and come and meet with us. And they literally opened their doors and their playbook to say, how can we do this? We've had a lot of success with our Black women, but how can we support the refugees and our women that are arriving already pregnant or here for the first time? And how can we support some of your other community members that maybe we don't have that type of experience with, but we can learn from you on how you're providing and supporting those patients. And then they've done some of that same culture education for us. There's other partnerships like the LGBTQ Center that has educated us on how do we support our LGBTQ plus community, both our employees, but also the patients who receive care from us. And I can go on and list a number of other partnerships. We have a new food is medicine program in partnership with our local food bank. And again, that's been critical for our patients who are food insecure. And we are prescribing, food to those patients who have diabetes or hypertension, but also leveraging a dietitian to educate them on how do you cook these foods, what do you do with them, and go one step further as opposed to just giving the food to them without any support and education on how do they really leverage and put everything together.
As you think back over the time that you've been with NFP, what success or accomplishment are you most proud of in that time?
That's a great question. I will go back to the outcomes that I shared on the slide, where we've been over the last 3 years for our care source patients in particular, our Medicaid care source patients, their overall costs have come in around $60 million less than the expected cost. And when I say 60 million, we're talking numbers. But for me, that correlates to patients. That correlates to a patient being able to go to work because they're healthier. That correlates to grandparent being able to play and interact with their grandparents because they're healthier. That correlates to a higher quality of living for those 13,000 plus patients that fall into that bucket. So it's been a savings on our overall system, but I believe that that's a true quality of life that's impacting our economic environment here in Cleveland, but improving how people are able to interact and get around. And I would say that is one of the ones that is most exciting to me and that I'm most proud of.
So now let's look ahead. What is the vision for NFP in the next 5 to 8 years?
I would say our vision is not so much focused on NFP and what we're going to do. As I shared, we want to be a catalyst for change. So our focus is going to be bringing our partners to the table to make sure that we expand primary and preventative care in our urban core. So we don't have to be the provider that is providing care to everybody in every neighborhood across Cleveland, but we want to make sure that we push the conversation and bring our partners, our hospital systems, our other federally qualified health centers, other small practitioners to the table to make sure that we are all learning together, improving the quality of care that we are providing, but more importantly, increasing access to those high value and high quality services. So that is where I see us in 4 or the next 5 years, is making sure that either we are expanding our reach and providing more care, but we're also bringing others to the table and saying, hey, we're all accountable for our outcomes today. And 5 years from now, we're going to see an improvement in those health disparities, those life expectancies, the maternal and infant outcomes, and that will be a success for us. We don't measure our success in the number of patients that we're seeing. Our hope is that patients get quality care by someone. If it has to be us, we're willing to step forward and push and see more patients, but we know that we can't do this alone. We need our partners across multiple spectrums, multiple sectors to do this work. And I think that's how I see our success 5 years from now, is that we were able to bring those partners together to achieve that.
For those of us that are on the call, how can we support you and your team in helping to achieve that vision?
I would say reach out, right? Reach out. Let's have a conversation. You know people that we don't know. You have connections. You're probably doing similar work that we're doing that we may be able to learn from, and vice versa. And I think that is the biggest thing that we can do today. Let's get in a room. Let's have a conversation. We can share more about what we're doing. You can share about your resources that you have available and the people that you're connected with. And that is the key thing that we need right now. You know, we talk a lot about fundraising, which is so important to nonprofits, but friend raising is just important. So making those connections and introductions are going to be key. And we would love to have those conversations with anybody willing to sit down.
And Dominic, since you came up here from Cincinnati, in your time here in Cleveland, what's your favorite part of the city?
I would have to say the lake. I grew up on the Mississippi Gulf Coast near a large body of water. And this was the first time since I left Mississippi in 2015 to have access to a large body of water. And it's just something for me that's so relaxing to be able to just sit down and listen to the waves, the wind that flows off of the lake. So that would probably be my favorite thing. And then after that, I appreciate the fact that we have the volume of major sports teams that we do have in Cleveland, although some of them aren't having the best seasons.
That's a very true statement. Dominic, thank you so much for all that you and your team are doing to help address the health challenges and provide access for those living in our community. And we look forward to seeing all of the great things to come from the team at Neighborhood Family Practice.
Thank you so much, Rachel. And again, thanks everybody for giving us a few minutes of your lunch. And we'll love to stay connected and have a conversation with anybody on the call who wants to learn more or partner with Neighborhood Family Practice.